Good evening. I'm on a wee rant tonight. During lockdown, we were assured by government that if we complied with the lockdown and followed all the distancing and mask wearing and stuff like that, we would be saving the NHS. Well, look at it now. What have we got? We've got people who have paid, members of the public, who have paid their contributions right from the first day of their working lives, and they're being told that they have to wait between 3 and 5 years for essential operations. Life-changing operations. 3 and 5 years. A lot of these people will be dead before they reach 5 years to get the benefit of these operations. People are being forced to go private if you have the money. I myself was told that in order to have a hip replacement operation and avoid being in a wheelchair, because that's how bad my hip was, I would have to wait 4 years, and I wasn't prepared to do that. And I spent £11,500 to get that operation privately. What do we see as we pass our A&Es on the drive home from work, or we're passing by? We see lines of ambulances sitting there waiting to unload patients, many of whom are in a critical condition, and there's no bed for them. And some of these patients are lying in the ambulance, and then they're eventually transferred to a trolley in the hospital waiting area, and they could wait 12, 24, 36, 48 hours before they are given a bed on a ward. Is this good enough? And what about this situation as regards trying to see a doctor face to face, to be triaged by a doctor, not to be triaged by someone who answers the phone? How can you triage somebody on the phone, and how can a receptionist triage you and assess, the seriousness of your condition? You can't do it. This is wrong. This phone consultation triaging is a nonsense, and it's a disgrace, and it flies in the face of anything that any nurse has been trained to do over the past 100 years. You've got to have a face-to-face assessment to look at the whole person, not listen to someone on the end of a phone line, someone who might give up trying to get through because it takes a long time to try and even get an appointment to see a doctor. It takes quite a time actually getting someone in the health centre receptionist area to even answer the phone to you. You're put on hold. And no one really is up in arms about this. This is wrong. Our MLAs are generally silent. Our MPs are silent. Our churchmen who should be defending the weak and the vulnerable are silent. I came across this article in the Belfast newsletter by Owen Polly, and I'm going to read it to you. Last week I needed to book an appointment for the treatment room to get a wound checked. Following a procedure to remove some metalwork from my wrist, I spent a day and a half trying in vain to get through on the telephone before deciding to visit the surgery in person. Although I joined a long queue of people checking into appointments, picking up prescriptions, and in one case making a complaint, I was eventually successful. But what a palaver! Prior to Christmas, my family had an even more frustrating experience involving our son, who came down with scarlet fever. The effects of this infection can be relieved quickly by antibiotics. The NHS advises that a child can be back at school 24 hours after they start their course of these drugs. Otherwise, children may get a high temperature, which tend to cause lethargy, confusion and other worrying symptoms. A small number of cases even have severe consequences, as we saw during the recent outbreak. To avoid this, my wife tried to contact the surgery before 9 o'clock in the morning, aiming to speak to a GP about our son and potentially get a prescription. About 10 o'clock, after around 100 failed attempts to get through, I joined the effort. A further 45 minutes and numerous attempts later, we finally got a line to the surgery, at which point the receptionist immediately put us on hold for another 15 minutes. This was not the end of the saga. To get a consultation, you must provide the receptionist with details of your complaint, and then the doctor eventually rings back at some unspecified point in the day. In our case, this happened to be about 5 o'clock. An entire working day was spent trying to get a simple prescription so that my son could start to feel better. As it happened, when my wife finally spoke to the doctor, he was very helpful. He faxed the script through to the pharmacy, which was open late, and adding a prescription for our 4-year-old in case he caught the bug and started to show symptoms later. So I tell these stories not to attack the services GPs provide or to cast doubt on their dedication to their patients. I understand they're overwhelmed and they're trying their best. But to say the least, this system, if it is replicated across the province, is unworkable, unsustainable, and will end up costing lives. Many people are simply not going to spend hours trying to get through to speak to a doctor, and it probably won't be the worried well who are easily deterred, but those who really need medical help. There are plenty of people, particularly men, who don't need much of an excuse to put off seeing the GP. Then there are all the routine appointments, which can seem less than urgent, but when problems are frequently discovered in those appointments. If you got a note on a prescription asking you to schedule an annual blood pressure test, for example, would you be put off by the fact that it might take most of the morning to arrange? I know I would. There are so many other potential examples where effectively dissuading people from calling the doctor could cause huge difficulties. Missed cancer diagnosis, patients who delay taking sick children to A&E because they want to speak to their doctor first, patients not getting the appropriate medication in a timely way. And the eventual repercussions are likely to include more sick people, more complicated patients for the NHS to deal with when they finally get treatment and no longer waiting lists. It's a vicious circle that means our health system is under even more pressure, struggling to meet demand with increasing numbers of problems building up. These aren't easy issues to resolve either. The idea of triaging our medical complaints over the phone became permanently entrenched during the COVID lockdowns. Many of us stayed away from GP surgeries and A&Es during that time, creating pent-up demand that was released when these restrictions were relaxed. Clearly, huge numbers of people are still trying to contact their doctors every day. At the same time, it can't be impossible for GP practices to install phone systems that accept greater volumes of calls, even if that means putting callers on a lengthy queue while they wait to speak to someone. It is not acceptable to routinely expect worried or sick people to endure hours of engaged tones, disconnected lines and disembodied voices intoning, "It has not been possible to connect your call," just to get through to a receptionist. There are public services like HM Revenue and Customs that deal with enormous volumes of calls. Contacting them may be a long and frustrating process, but at least you get connected and wait, and if you wait it out, even if that means listening to the tinny music all morning over the speakerphone. We know that Northern Ireland, the NHS, has missed out on decades of reform thanks to the inaction of devolved ministers. One of the themes that keeps running or reoccurring in various reports that remained unimplemented over the years was the need to improve primary care and look after people in the community. If that work had been done, maybe contacting your GP would now be less frustrating and time-consuming experience. And I would like to add another piece to this, because if you are having difficulty, you're wondering why it is that our A&Es are inundated. You walk into an A&E waiting area and it's absolutely bunged. Why is that? Well, people have found that they can't wait on the end of a telephone line for the receptionist to get through to them. They can't wait for a whole day for a doctor's call to come, or the doctor will speak to you a week ahead or 10 days from now. So what do? They go to A&E. That's one of the reasons why our A&E are bunged. And whoever brought in this nonsense of phone consultation triaging is clearly a fool, in my opinion.